But now, there are vast amounts of research suggesting and proving that smoking tobacco is harmful to your health. And with the latest electronic devices hitting the market offering a way out for smokers, researchers are on the ball to investigate just how safe these devices are. And how are the multi-million-dollar tobacco companies handling this competition? Joining us via Skype from London is the Vice President at Reason Foundation, Julian Morris. He is also the co-author of the latest report. To tell us more, Julian, a very good morning to you and welcome.
Good morning.
Tell us about the key findings of your report. What came out of it?
So I did a survey of the literature on the use of vaping products, what some people call electronic cigarettes, over the course of the past decade. And the evidence is overwhelmingly in support of the use of those products as smoking cessation aids or as substitutes for smoking. So far, around 10 million people around the world have switched away from smoking by using these electronic cigarettes or vaping products. And as a result, they are far less likely to die from the many diseases that are related to smoking. Electronic cigarettes have much lower levels of most of the harmful constituents of tobacco smoke, especially the most harmful constituents, the ones that cause cancer, heart disease, and these other problems. As a result, many groups have been advocating that people use these products instead of smoking. Public Health England, for example, has reaffirmed an estimate produced in 2014 that the use of e-cigarettes is about 95% safer than cigarettes. More recently, this year, the Royal College of Physicians came out with a report also asserting that these products are at least 95% safer. So there's an overwhelming evidence now that these are safer, they are enabling people to quit, and they are not also, one other problem that's been kind of brought up in relation to e-cigarettes is the possibility that they might lead some people to take up smoking, but that is contradicted by the evidence. The evidence says that the opposite is true. Even among children, e-cigarettes are being used instead of cigarettes. So they're stopping people, they're discouraging people from initiating smoking. So we concluded in our report that if people were able to switch to e-cigarettes over time, you might see a dramatic fall in the incidence of smoking-related diseases. And we also looked at the evolution of these technologies, so how they developed and how they've improved in quality and declined in cost. And over time, you've seen increasing uptake of the technologies, especially in markets like the United Kingdom, the United States, and France and Malaysia, where access has been relatively open and where the development has been uninhibited by government intervention. In those countries, you've seen the development of newer technologies that are less expensive, that enable people to vape a variety of flavors. And so in the UK now, about 20% of smokers and former smokers, recent former smokers, are vaping, and about half of those, about 1.3 million people in the UK, are vaping, only vaping. And the proportion of people who are vaping exclusively has been rising. So you've got, I think, overwhelming evidence that these things can be transformative for smokers. The big challenge is enabling greater access to the technologies around the world, especially in societies where the ability to purchase the product is less, so in poorer societies. But our belief is that as the technology evolves over time, the cost will come down and it will become increasingly possible for even poorer societies, especially places like South Africa, for people to use these as a way of switching from smoking. Something which a significant proportion, between 40 and 50% of people who smoke try to give up every year, but 95% of those fail. With e-cigarettes, with vape products, there's a much higher rate of success in quitting smoking and staying off cigarettes.
Yes. It must be said that the multi-million-dollar tobacco companies are probably not handling this well. What do you say to that, and why do you also say that the Framework Convention on Tobacco Control, the FCTC, created by the WHO, is failing?
So the Framework Convention on Tobacco Control was created in 2004 and it came into force in 2005. Since that time, the number of smokers in the world has increased. They've increased especially in poorer countries, in Africa, in Asia, and in Latin America. The number of smokers is rising. So the stated objective of the convention was to reduce the incidence of smoking and smoking-related diseases. And unfortunately, since it's come into effect, that the incidence has increased. So it's clearly not worked on its own terms. And part of the problem, a big part of the problem, is that it focuses only on the solutions that have worked in richer countries, and it hasn't looked at ways of enabling people in poorer countries to switch. And in richer countries, the ways that have worked are more or less threefold. So you've had increases in the cost of tobacco products, especially cigarettes, but mostly through taxes. You've had public information campaigns, and on top of that, you've had a very wide access to smoking cessation clinics and drugs and so on. Of those, in poorer countries, it's more difficult to impose taxes because of the potential for smuggling. I mean, that happens even in rich countries, but it's more difficult in countries. There is less money available for smoking cessation clinics and the like. And public information campaigns, they work, but they work mostly in collaboration with these other systems. Now, one other technique that's emerged now in richer countries and in some poorer countries is alternatives to smoking, but that is not being advocated in the FCTC, in spite of the evidence, the wide evidence now that millions of people are switching away from cigarettes by using these alternatives. In fact, the FCTC has been quite hostile to alternatives. It was hostile to snus,
yes,
which is a smokeless tobacco that's very effective. Yeah.
Yes. Julian, that's where we got to leave it. We got a lot more to talk about, but unfortunately, that's where we got to leave it for now. There's Julian Morris. He is the Vice President at Reason Foundation and also the co-author of that report that suggests that cigarettes is harmful to your health and vaping is probably the way to go. Well, make up your own mind. We'll take a break and we'll be right back after that.